Thank you for tuning in to Global Elite Consultant. Today we're going to teach you how to open up or add IHSS to your non-medical home care agency. Now, in each state, it's called something different. So in Georgia, it's called the Community Care Service Program, which is CCSP. And it's this is Georgia's HCBS waivery program, which is your community-based service waivery program in Georgia for elderly adults 62 and over and disability patient. Okay, so this is for non-medical agencies. So you have to have a non-medical agency in order to be able to provide this. The other one that they have is a source waivery. It says that this service options using resources in a community environment. It also provides adult care, personal care, home delivered meals, respite, and other support to Medicaid eligible people living in the home. And the other one they offer is a little different from IHSS, but is if your family wants to be your caregiver. It's called SFC, which is Structured Family Caregiver. Okay, so how to apply for this services? If you want to apply for the care services for loved ones, well, for this one, we're only going to tell you how to apply as an agency. So you will become like a paid provider, basically. That's only what we're going to go over here. Okay, so they have an enrollment, providers enrollment with Georgia Medicaid. Use the Georgia Provider Enrollment Unit. The providers must register through the Georgia Medicaid Management Information System. It's called MMIS, and receive a Medicaid provider number before billing Medicaid. So you're going to go to this website, which I'll give you the link. You're going to create an account in the MMIS Providers Enrollment System. You're going to complete all the required forms and upload whatever credentials they ask you to. And then you'll receive your Medicaid provider number once you approved. And they do have just a direct email here. Website is mmis.georgia.gov. So that's the address that they're giving for the MMIS Providers Enrollment. Again, mmis.georgia.gov. In order to apply for this, you must already be licensed as a home care provider agency. And which I told you before, in Georgia is called private home care provider. I told you that on the other audio about how to open up an agency in Georgia. It's on there, on that audio. It's telling you how to apply for to get a home health agency there, non-medical. Okay, so you're going to submit your application for the license. You have to do a background check. And once you're licensed, you can enroll your agency as a Medicaid provider if you want to receive Medicare, if you want to serve Medicare patients, okay? Or the home-based patients. Okay. So they just give you a lot. There's some more contact. I'll just put them in the link. It's like the Georgia Department of Community Health, private home care providers licensing. I'll put that in there. I think I have it on the other audio, but I'll put it on this one too. This is the Georgia Medicaid Provider Enrollment Portal, that MMIS portal. The Georgia Department of Human Service Division of Aging Service. I'll put that in there. So, yeah, you would fill out the application and then you would just apply for your, like I said, for your license. Let me see, what do they pay? Let's see if they have a fee. Yes, in Georgia, you may have to pay an application fee to enroll as a Medicaid provider to the MMIS system, but it depends on the type of provider you are. So let's see who pays for that. Individual practitioners and non-physicians. Let's see. Your agency, it does have such as agencies, facility, and certain practice groups are generally required to pay an application fee. What's the application fee? All right. The fee amount for the institutional provider, which would be you, is set federally and may change each year. For example, for 2024, it was about $709 for Medicaid, Medicare enrollment application fee. The federal level figure, which many states align with CMS guidelines. When is the fee charged? The fee will be collected as soon as you enroll with your application. And it's not saying what the fee is today. It's only saying what the fee was in 2024, which was $709. Now, there is a hardship waiver. There may be a process to request a hardship waiver of the application fee if you believe paying it would cause undue financial difficulties. Forms for that are available in the enrollment documents area on the MMIS portal. So if you feel that you couldn't afford to pay that and it may hinder you from operating your business anyway, or you could fill out that form. They can either, you know what, you could fill it out because they could either say yes or no, really. So I would fill that out if I was you and you really needed it. But the only thing, like I said here, they just have $709, and that was in 2004. So clearly, it must go up yearly, which means we don't know what it is now. Okay. Okay, now let's see if we know what they pay. Let's see if there's a fee that they charge, how much your fee would be for taking these. Okay, wait. Actually, it doesn't say. Wait. Well, yeah, it doesn't. Medicare pays the agency a higher rate. The agency then pays the caregiver or the worker. The agency's reimbursement, oh, here it is between $18 to $28 per hour, sometime higher for enhanced care. The caregiver wages, I guess in that state of Georgia, is running anywhere from 11 to 15. I'm pretty sure it's not 11, it's probably 15 an hour. So that's probably what it's probably. I'm thinking 28 because in Colorado they pay 28 and some change, and then I think Arizona they pay around that too. So it's probably about $28 that you'll get. This is through the Medicaid waivery program, and so the caregiver would get 15 an hour, and you would get the rest. The difference between the 15th and the 28. Now, let me tell you that. Oh, wait a minute. Here's something else. Okay, so, oh, yeah. So for the family pay, it's going to be, this is the closest thing to IHSS in Georgia. And the monthly payment for family is anywhere, depending upon the hours, is $1,200 to $3,000 per month. That's for the caregiver. If it's a family. And okay, it's all right. So that's about what they're okay, it says that the Georgia does not pay 24/7 caregiving like California IHSS does. Ours are capped by the care plan. So it depends. I don't know how many hours they're paying. So they don't pay for 24-hour care. They just pay for a certain amount of care. So they might pay for 12 hours a day. They might pay for 15 hours a day. They may even pay for, you know, I don't know, but they could pay for if 24 hours. Well, it says it don't pay 24/7, but then they might break it up though. I'm not sure, but it pays by the hour. So California pays the whole 24-hour care if they need it. It's saying that Georgia don't pay 24-hour care. So maybe Georgia might pay 12 to 15 or 20 hours a day, something like that. You'd have to wait till you got the information and look that up and see exactly what they're paying and what their pay structure is. But it seems to me, and I've looked at a lot of these in all different states, and it seems to me that the pay is pretty much the same. And every state looks like it's running $28 for 2025, maybe just hitting for 2026. They might be paying $29 an hour. Now, you have to understand this is for the Medicare. This is not for private pay. Private pay pays more than that. I don't know what private pay pays in your area because, we'd have to check that in the Georgia area. But I'm thinking it's probably going to be anywhere from 15, probably 15 to 18, probably. Because after COVID, the rates went up. So I'm thinking between 15 and 18. That's what the caregiver gets paid, between 15 and 18. Private pay is going to be more than that. I don't know what it is in Georgia, but if I'm going to say if it's compatible to like Arizona, it might be anywhere between, this is what you would charge the patient, anywhere from $28 an hour to $38 an hour. And you would pay the caregiver out of that, and then, 15 or whatever you're paying the caregiver, 15 to 18 an hour. So if you're paying the caregiver 15, then the difference between like 15 and 38, you would keep the rest, okay? Because private pay, the caregivers definitely are going to get paid more money, or you're going to receive more money than what you get for the Medicare patient. That's going to be lower, and it looks like it's like 28 an hour here for the Medicaid. So you're going to get way more than that. If you need any help figuring this out, for us to look up and see what they're paying in the state, or any type of help that you need, maybe getting your license or anything, go to globaleliteacademy.net. globaleliteacademy.net. Fill out the contact form. We'll give you a call within 48 hours, or look up our phone number and give us a call. Thank you so much. Have a good week and Happy New Year.